People who receive care compassionately are much more likely to adhere to their treatment. It can be really little things that make a big difference.
Hi, I'm Laura Neilson and welcome to Hope in the Deep End. We've put together this podcast to inspire us all to keep working in areas of deprivation and poverty. We're sharing best practice, stories, outcomes and some interesting thoughts and ideas. So whether you're working in primary care, secondary care, the charity sector or any of the other myriad of roles, please listen and help us to keep each other inspired. Hi, welcome to Hope in the Deep End podcast. I'm with Jen Davies, who's a clinical psychologist, and this week we are talking about compassionate care. So how can we deliver compassionate care and how can we be compassionate to ourselves as we go about our work? So welcome, Jen.
Hi, thank you.
Lots of us do some quite interesting jobs, don't we? Mm-hmm. And we love our jobs, but there is also a kind of edge to it, isn't there? So whenever you're working with the public, I think in any service, there's a certain cost to that, isn't there, as a person? Yeah. So today we're going to explore, how do you be compassionate? How do you keep compassion? And how do you look after yourself compassionately? Start us off with, what are the benefits of delivering care in a compassionate way?
Oh, they're huge. So I guess we might think that we know this intuitively, that it's good to be compassionate, and a lot of different religious approaches and a lot of different secular approaches as well have compassion as a core element. But we've also got lots of science that backs that up now. And there's been some writing in the field of, I think it's called compassionomics, which brings together sort of economics and compassionate literature to see what are the benefits on a financial level as well as kind of a feeling good level as well. And they're huge. So we see benefits in terms of, if we offer care compassionately, we can see benefits in terms of the practical applications. So, for example, people who receive care compassionately are much more likely to adhere to their treatment than they would otherwise. We've got evidence of that. In terms of like the illnesses they might experience, their immune response system is improved, so that they're likely to experience symptomology for less time and at a reduced level as well. And even things like neuroendocrinological, I think I've said that right, changes are evident. So, for example, people who have compassionate care are more likely to have their blood sugars at a good level when they have diabetes as well. So there's lots and lots of evidence now about how it can be helpful in NHS settings. But it's easy to say that and it's harder to do.
It is harder to do. So when we talk about compassionate care, what do we actually mean?
Mm-hmm. So that's a really good question. And I was doing some training yesterday when I asked the people who were there, the participants, what it meant. And there was some great answers. Like, it means using empathy, so you are able to understand where that person is coming from. It means that person feeling like they've been heard, understood, and that the person with them is working alongside them to help find a solution to their problem as well. So there's some kindness in it, but it's also, I guess it's a strong kindness, because I think sometimes we think of kindness as being a sort of fluffy thing, whereas actually compassion, in the way we might understand it, or the way I understand it, is it actually takes huge strength and commitment to be genuinely compassionate, because you've got to sort of turn towards the suffering of somebody else and you've got to commit to do something about it, which is actually really hard. It's really hard work to do that, and it has a cost for people doing it as well. And I think that's why often people who work in healthcare settings go home feeling absolutely exhausted, not just because of the hours they work, but because emotionally they're putting a lot into it. By turning towards suffering, easier to turn away from it sometimes.
Yeah, and I don't think many people actively turn away from suffering, but I think people hide. So I think it's easy on a shift to hide behind protocols or like mapping in our heads. So, as a doctor, I kind of have my way that I've been taught to differentiate, differential diagnosis, and I can kind of hide behind that, and I can actually deliver on paper really proficient medical care, but not be very compassionate. So I don't think many people turn away from it, but I think we are more than capable of hiding more than we probably admit to ourselves. Does that seem possible.
Yeah, absolutely. I think so. And it's about people, we're very attuned to other people because we're social beings, and we can tell if people are compassionately available for us. So I'm remembering a sort of personal experience of this where my mum had an eye operation really recently at the beginning of the month, and she came out of that saying, I've had a delightful experience. And that wasn't because it was a brilliantly successful operation, we don't know that yet, but it was more because when she arrived, there was a healthcare assistant who helped to negotiate the parking system. When she got into the ward where it was due to be done, her name was used by the receptionist, and she said, it was good to see her again. It was because instead of saying, oh, there seems to be an emergency when their eye pressure was too high, she was told, oh no, you're on an express route. and also this was the thing that really touched me, like when my dad was parking the van outside and probably feeling a bit anxious and checking that he'd got it in the lines, the car park attendant came over and sang to him, "You are my hero." And all of those things were like real examples of sort of compassion, where somebody working in the healthcare system saw what somebody might need and offered them that, which was above and beyond like what you're talking about, the kind of the nuts and the bolts of the care that you might offer.
Yeah, that's really interesting. So I had a similar experience. So I was in hospital and I'd been like hit by a car. So technically they'd done all the stuff they needed to do. And this nurse came over to me and I was like, you just feel completely odd, don't you? And discombobulated. And she said, what can I do to help you? And I said, I really want my hair washed, because it was like, like really old dry blood still stuck in my hair from kind of a couple of days before. And she said, oh, we're not allowed to wash hair anymore. And then she went away and spoke to her friend, and her friend came in and said, oh no, I know how to do this, we used to do this in like the 70s or whatever. And so they kind of shuffled me up the bed because I wasn't allowed to move, and like washed my hair off the end of the bed. And just the care of doing that, but also the fact that I didn't have to smell the blood anymore, and it just made me feel so much better as a human. Even though actually the situation hadn't changed, I was still stuck in a bed and I was still, quite unwell. So sometimes it's those small things, and it did cost them, because it cost them time and it cost them like creativity and how to find it, how to solve the problem. But, as a human, it was just that moment, wasn't it, where you're like, oh, thank you.
I've been seen and responded to as a human. That's gorgeous. And there's some lovely examples of this. I know they did some research, it's American research with people accessing oncology services, and what they found was if they added 40 seconds of compassion to their interaction. So they started the beginning of the interaction by saying, hi, I know I might say things that will be difficult to understand. Feel free to stop me. I want to be alongside you and be helpful to you. They did that at the beginning, and then they sort of revisited it at the end, just added 40 seconds of chat. And they found a massive difference in terms of outcomes for the people going through that service as well, in terms of their anxiety levels and outcomes. So I know, as you say, there's a cost in terms of time, but actually it can be really little things that make a big difference. There's some lovely examples as well in there's some writing in the Harvard Business Review actually that was looking at a healthcare system again in America, where they found making changes such as the receptionist saying, instead of saying you need to come back in 2 weeks, saying the doctor would like to invite you to come back in 2 weeks, actually meant that people were more likely to attend appointments again. And they had lots of lovely examples where they managed to turn around a system that was seen as failing because they tried to make heartfelt connections, they called it, with their patients.
That's really fascinating, isn't it? So just that shift in language changes how people receive and perceive what's going on. That's really fascinating. That's really interesting. So I can see, as a kind of person who's working, I really want to be compassionate, but there's always a point in the day where it like runs out. Like I don't think it's on a timer. I feel like in my head sometimes it's like, when you've got one of those sand timer things, you flip them over and then suddenly all the grains have gone. And what can we do if that happens to us? How do we, because I don't want to be the person that turns away, and I don't want to be the person that like just hides, but I do know that in an 11-hour shift there's that point where I just go, oh.
Well, yeah, exactly. And I think it's recognising that first, that actually we do have our limits, and that's absolutely understandable. And that the systems that we work in often ask a lot more of us than we can reasonably deliver. So I think recognising that is a good point. There's a model of compassion which is called the compassionate mind training model, and that sort of has been used within compassion focused therapy, and I find that really helpful. So it basically talks about us having 3 different emotional regulation systems. It talks about the threat system, which is developed to help us survive, and that operates on a sort of better safe than sorry principle. So it fires really quickly. So if we think there's danger around, our fight and flight will kick in, or freeze. So the thing that you were talking about earlier about maybe turning away from stuff or not engaging with it, it's protective, that it stops us getting overwhelmed by it. So we've got that threat system. And that's associated with cortisol rushes as well. Then we've got a drive system. That emotional regulation system is the bit that helps us get up and get things and do things, and that's associated with dopamine. So we get a nice rush when we feel like we've been successful at doing something. And then the third emotional regulation system that they talk about in this model is the soothing system. And that's the bit when you don't have to go and get resources, there's no threat, and you just feel calm and safe. Now, what happens is when you're in a healthcare setting, both patients and staff often have their threat triggered because it's health stuff. It is actually things that are going to make you worry. It's the soothing system that we could really benefit from trying to activate in those settings if we possibly can, which is easier to say than to do. But if we're able to think about what helps us get into that very calm, soothed place in other situations, we can call them to mind in the moment, and that can really help. So for example, I've got a particular image that I think about that just makes me feel much better about life. And it's taken a while and a lot of practice, but I can feel levels of panic coming up in me. And if I think of that image, because I've practiced, I can quite quickly get into a more soothed space. And we know that we can use our different senses to get into that soothing network as well. So people are often soothed by smells. So I know some people who use washing powder that they find really nice, or they wear a perfume that is good for them or an aftershave that's good for them. And when they feel the anxiety coming up, they just have a quick sniff. And it quite quickly grounds them. Or touch. Some people have things that they touch, and it might be that that's connected with spirituality as well. They might have an object that they touch that helps ground them. So it's a sort of an individual thing in that sense, about trying to find what helps you soothe most in the moment. And if we're more soothed, our patients are able to be more soothed, and we get less difficult interactions generally.
That's really interesting. So I guess that could be anything, couldn't it? That could be like songs, that could be memories, it could be thinking ahead, I'm going to see my friend on the weekend, isn't exciting. So anything that kind of, I guess you're saying, in your kind of neuroendocrine system, switches the cortisol and dopamine off, and releases the kind of serotonin and those kind of pathways, oxytocin those pathways. So that's really helpful. I think thinking about how patients are coming to us, obviously they're not going to be in a soothed state.
No.
So I'm thinking about, often we know, don't we, in the big situations when we're giving big news, or when someone's had a big accident, we kind of inherently understand that there's a threat. I think sometimes I forget that when you come in with your child who's vomited twice, that for me this is, not very threatening. And, there's lots of chat in the healthcare system about these people should go somewhere else. But actually for those parents, they're in that threat state, aren't they? Yeah. And so my response to that needs to be to soothe, because I'll have a better interaction and they'll feel more satisfied, rather than a kind of heightening the threat by telling them off, that kind of even subtly. Yeah. So I think that's really helpful. I was really intrigued by your thing about the threat system then releases loads of cortisol. So this is just an observation. I tried this week to not eat sweets all the way through my shift, because I was like, I'm going to be healthier. I'm going to not eat my body weight in Haribo every shift. And I got to about 6 hours in, and then I was like, no, I just need some sweets. And I think actually it's probably the sugar's a soothing thing, isn't it, for me, rather than the kind of, the rest of the week I don't eat like that. So that was really interesting. That's possibly like an unconscious soothing of threat.
Yeah. And that taste that you associate that taste with then calming. Yeah.
That's really interesting.
Maybe swap something in for your Haribos if you want.
That's really interesting. So there's loads, isn't there, in this compassionate model? So it's about if you can think in your head when you're with somebody, are they threat? Are they drive? Are they soothing? And that we're going to try and move people to soothing, both us and them.
Yeah.
I think that's really powerful. So you think about the drive thing. I often some of the most difficult interactions with patients are actually when they're clearly driven, they want an outcome. And they're like, I will have this. And actually understanding that is, some of that is subconscious for them, I think could be really helpful rather than winning the logical argument.
Yeah, absolutely. Yeah. And again, it sounds easy when we say to do that, but it's hard work doing that because we're designed, as we're saying, the threat system gets triggered quite quickly for us as well. Yeah. And I think particularly when you work in healthcare, and a lot of us get so much reward from working in healthcare, it can trigger our threat not to be able to help somebody. And that can make us panic more in itself. Yeah, and it's harder to get into the soothe system as well.
That feeling of being helpless is horrible, isn't it? It doesn't happen very often, but I actually said it out loud the other day. I said, I just feel really helpless with this person. I don't know what to do. And it's interesting. It was a healthcare assistant who I work quite a lot. It's like, oh, Laura, you'll be fine. You'll work it out. And obviously, just that helped me soothe down. Yeah. But that kind of moment where I was like, I don't know what to do with this person. Yeah. Yeah, is a threat in itself, isn't it?
And that is a beautiful example of the other thing we need to think about. So we need to think about the patients being in threat and trying to help them get to soothing, us being in threat and trying to get soothing, but also the people around us. As a team, what do we do for each other that encourages a more soothing environment? And that example of talking to your colleagues is about being able to get some of that stress out and re-engage with your soothing system. Absolutely. Yeah.
So if we think about how our healthcare system's set up, actually it's really fascinating. So what we ask people to do is, I think in primary care we ask people to do like 4-hour blocks. Now 4 hours is a long time, seeing someone every 10 minutes with a new drive or threat presentation to you. So actually if we're going to take this seriously, we need to think about how do we build compassionate care in and not be asking people to do things that are actually impossible.
Yeah. And having breaks within that where if you're in a threatening situation but you know you've got a break coming up where you will be able to do something that is soothing to you and or connect with your teammates, then that is really helpful. That is really helpful. So if you know that is protected, you have time coming up to process.
Okay. So actually building in this time where colleagues can have the conversation and de-escalate each other is really important.
Yeah.
Like informally.
Absolutely.
Yeah. Okay. That's amazing. So the evidence is there from, I think it's really interesting that the science is now showing what I guess a lot of cultures and spirituality is known for a long time. So that's really fascinating. I guess the challenge for all of us is how do we actually embed this in our normal rhythms and our day-to-day? And have you got any final top tips for that? Anything that's worked particularly for you or for people you've been helping?
I think it is about having these sort of conversations as a team and about trying to generate what feels like real and realistic, implementable ideas, because otherwise it gets dismissed, I think.
So airy-fairy.
Yeah, absolutely. And like, we're just being told to be kinder again, and it's our fault, and that can feel punitive and a threat. So I think it's about working with people with all different roles within an organisation to think about how do we make this the most compassionate culture that we can together. What will help it feel more compassionate to you, and therefore you'll be more able to offer compassion to the people accessing the service.
And it's really important, isn't it, whether we're working in healthcare or social care or the charity sector, actually it's all quite similar in some of this. So, our reception staff actually deal with a lot of threat, don't they? And the kind of emotional toil of that. So actually how do we as a team work that out together as well? It's not just the clinicians, is it? It is. It's
as a team, and it's celebrating when it's working, because there's beautiful examples where I work where reception have just managed to handle a really difficult situation, helped people get into a soothing place, and then they're able to access healthcare, whereas they wouldn't have been if we hadn't had those really skilled people on our front line, as it were. So yeah, I absolutely agree. Making sure that everybody's involved in the conversation, but also celebrating when it's working and doing more of those things that seem to be working.
Yeah, that's really important, isn't it? So thank you so much. It's fascinating. I think it's something we will return to again maybe at some point, because there's a lot in this, isn't there? Is it possible for us to put a few links on the information for people if they want to go and have a bit more of a read or a bit more of a listen to find out more about it? That's great.
Yes.
Thank you so much.
Thank you. Lovely to have the chat.